This Sunday marks 2 years since I declared a public health emergency of international concern, the highest level of alarm under international law over the spread of COVID-19. At the time, there were fewer than 100 cases and no deaths reported outside China. 2 years later, almost 350 million cases have been reported and more than 5.5 million deaths. And we know these numbers are an underestimate. Last week, 100 cases were reported every 3 seconds, and somebody lost their life to COVID-19 every 12 seconds. So where do we stand? When will it end? It's true that we will be living with COVID for the foreseeable future, but learning to live with COVID cannot mean that we give this virus a free ride. It cannot mean that we accept almost 50,000 deaths a week from a preventable and treatable disease. It cannot mean that we accept an unacceptable burden on our health systems when everyday exhausted health workers go once again to the front line. It cannot mean that we ignore the consequences of long COVID, which we don't yet fully understand. It cannot mean that we gamble on a virus whose evolution we cannot control nor predict. It's dangerous to assume that Omicron will be the last variant or that we are in the end game. Ending the acute phase of the pandemic must remain our collective priority.